Wrist pain can be a difficult problem to work out what's going on because it's a complex area involving many different structures crammed into a small space. So in this video, I'm going to try to help. I'm going to go through the 10 most common causes of wrist pain. I'm going to show you how to determine which of these conditions you might have, and then point you to a more detailed video about that particular condition so you can find much more information, including the most effective self-help treatments, and also some of the other treatments that might be available for that condition. So this is very much a signposting video to help get you on the right track. I'm Stephen Bunting. I'm a specialist MSK physiotherapist and sonographer based in the UK. Welcome to my channel, where I discuss the common MSK conditions that affect everyday people and the evidence-based treatments that can help. So this video is designed to help you identify which one of the top 10 wrist problems you might have. And then, once you've found the condition that best fits with your symptoms, you can then look in the video description to find the particular long form video, which then goes into the details of your particular condition. So that's how I hope it's going to work. I'm not going to include wrist fractures, which are of course another common cause of wrist pain, but they are a separate issue. But if you do have a confirmed wrist fracture, then this video isn't for you, but I've covered wrist fractures in detail in another video, which you can see up here and also in the description. Okay, so on with the remaining top 10 causes of wrist pain. And I'm going to start with a simple wrist sprain. And I say simple, but wrist sprains can be very painful and feel far from simple, but in most cases they do get fully better fairly quickly. So a wrist sprain is always caused by an injury, often a fall onto a hand or a twisting type injury, which causes the wrist to stretch suddenly beyond its typical range of movement. There will be instant pain and sometimes bruising and swelling. You might think you've broken it, and so you might have already gone to an urgent care centre and had an X-ray. If there's no fracture, then it's usually diagnosed as a sprain, which is essentially a tearing or stretching of the wrist ligaments. The direction which your wrist was forced into will determine which ligaments have been injured. It might be ones on the side of the wrist, or the front or the back of the wrist. So if you think you've got a wrist sprain, then go into the video description and find video 1 all about wrist sprains. For everyone else, let's move on to the next most common wrist condition, which is basal thumb arthritis. So in this condition, the pain is usually localized to the thumb side of the wrist and the base of the thumb just here. The pain will often be a deep ache, which is aggravated by pinch gripping activities, particularly pinching whilst twisting. So something like turning a rusty door key will be typically painful. There's often no injury, it tends to be a slow burn, and it commonly lingers for many months before people go and get it checked out. It's a very common problem, especially in middle to older age. So if you think you might have thumb base arthritis, then you will find my detailed video all about this condition in the description. So if that's you, off you pop. For the rest of you, let's move on to condition number 3, wrist tendonitis. So this is a condition where one or more of the wrist tendons become irritable and inflamed. There are many wrist tendons surrounding the wrist joint, and any of them can succumb to tendonitis, but by far the most common ones are the ones which live on the thumb side of the wrist just here. And it's got its own name. It's called de Quervain's tenosynovitis, and it's essentially an overuse condition, typically caused by repetitive wrist movements, and is most commonly seen in young mums due to the lifting of their newborns. In fact, in the USA, it's called mommy thumb. The pain is usually localized to the radial styloid region, which is the bony prominence just here, where it's often quite tender. But apart from de Quervain's, any of the other wrist tendons can also be affected by tendonitis, and so symptoms can occur pretty much anywhere around the wrist region, depending on which tendon is involved. But they all share the same features. Number 1, There is usually a repetitive overuse history. I commonly see it with excessive mouse, keyboard or tablet use, gaming, factory work, that sort of thing. Number 2, the pain is usually localised to a small area corresponding to the tendon involved, and it'll be tender if you press it with a finger. It might feel achy, but with intermittent sharp stabs of pain during certain wrist movements, and there might be some swelling along the tendon as well. Number 3, because it's often an overuse problem, there will be certain wrist activities which always cause the pain, and resting it will generally reduce the pain. Okay, so that's wrist tendonitis, including the Quervains. So if you think you have this condition, then go and see the description for the full video. Okay, so on to wrist conditions number 4 and 5, carpal tunnel syndrome and ulnar nerve syndrome. Carpal tunnel syndrome is a problem where a nerve, called the median nerve, becomes compressed in the front of the wrist just here. So one of the symptoms is a sharp pain in this area, which can also shoot down into the fingers. But the most common symptom isn't actually wrist pain, but is a numbness or tingling sensation in the palm and the fingers. Symptoms are often worse at night and first thing in the morning, but they can also occur throughout the day, with certain activities classically holding a phone, driving, or reading a book. In more severe cases, the numbness can become continual, and you might notice grip weakness and clumsiness. The median nerve supplies this area of the hand with sensation, and so that's where the symptoms tend to be. You'll note that the little finger and half of the ring finger is supplied by a different nerve, the ulnar nerve. So if your tingling or numbness is in the little finger and part of the ring finger, then you might have the other common nerve condition involving the ulnar nerve. You'll find links to both of these nerve conditions in the description. Okay, so next up is wrist joint osteoarthritis. So in this condition, symptoms are going to be similar to the thumb base arthritis that I spoke about earlier, but the pain is now felt deep inside the wrist joint, usually fairly centrally and most often on the back of the wrist. But people can sometimes find it difficult to localise the pain, and they might indicate the painful area by using the C sign like this. The pain is often dull and achy and worsens with prolonged rest, especially first thing in the morning. It will often feel better with gentle movement, but strenuous movement will also increase pain. And there will usually be some wrist stiffness if you compare with the other side, unless you've got it in both wrists, of course. And there might be some diffuse swelling or bony thickenings around the wrist. An X-ray can confirm the diagnosis. My video about wrist arthritis in all its different forms is also linked to in the description. Now, wrist arthritis is a degenerative condition which is strongly correlated with age, but there is another type of arthritis which can also affect the wrist, and this is inflammatory arthritis. This can include a variety of different conditions, including rheumatoid arthritis, psoriatic arthritis, and also conditions like gout, and it can occur in the younger age groups. The features of an inflammatory arthritis are wrist pain, which can be severe, but also swelling, local heat, redness, and a general angriness of the wrist and sometimes the finger joints. There is also often joint stiffness, which tends to be worse after rest and particularly first thing in the morning, when it might take an hour or two to settle down. Anti-inflammatory tablets or gel can often help with these conditions, but if you are at all concerned about the possibility of an inflammatory arthritis, then you must get checked out by a healthcare professional soon, because untreated, they can cause permanent joint damage. I'll put links to a video looking at the differences between rheumatoid arthritis and osteoarthritis in the description, and also a video about gout. Okay, so that's the top 7 risk conditions done. Just 3 left, and all of these remaining conditions cause pain over the little finger side of the wrist, just here. First up is pain associated with the distal radio-ulnar joint. So in this condition, the pain will be felt in the region of that bony bump over the back of the wrist, called the ulnar head. Pain will usually be aggravated with forearm rotation movements, particularly when gripping things at the same time. So things like using a screwdriver might be particularly painful. If you have similar pain, but more towards the wrist joint, so between the ulnar head and the base of the little finger, then you might have condition number 9, ulnocarpal pain. Or if the pain is more over the palm side of the wrist joint, just here, then you might have the last condition in our list, pisotriquetral joint pain. And of course, you will find links to all 3 of these last conditions, yes, you got it, in the description. Now, there are of course some rarer causes of wrist pain which I haven't included in this video, some of which I've also covered in different videos previously, so do check out the back catalogue. And you can see some of these conditions popping up here. Well, that's about it. I do hope you found the video helpful in determining which type of wrist problem you might have, and then from a position of knowledge, you can then discuss this with your own doctor or other healthcare professional. Please feel free to leave me any comments. Did you find this type of video helpful? Did you manage to find your wrist condition? What was it? And did the longer video then help? I'd love to know. Okay, well until next time, take care and bye for now.